Hi everyone, Dr. David Gabriel, naturopathic doctor and registered acupuncturist. I know it's been a couple weeks since I dropped a video, so I just want to talk about something that keeps coming up in my private practice, and that's people that have high stress, anxiety, and panic attacks, and that sort of thing. Um, it's very unfortunate when someone's dealing with that kind of ailment, and it could be something that has a deep-seated psychological origin. It could be something that's more mechanical, physiological in their body. It could be because of some home problems, domestic problems. It could be work issues. It could be anxiety and stress due to your own health condition, or any combination of these things. So it can get quite complex. And so when I get a patient, and it happens quite often, that is dealing with anxiety or high stress, I employ a whole family of methods to treat them, and I am very successful when I do that. But today I want to talk about one particular method, and that's using breathing to help people stay calm. Now, I want to give you a little bit of background about the unique position that the lungs hold, just a little bit of background about the nervous system, then talk about the actual breathing technique, and then we'll wrap it up. Okay, so I'll try and be as quick as possible and still make sense, which we'll see. We'll see if I'm successful at that. Okay, so first a little bit of background. So we have major organs. You know, we got our spleen, our liver, our heart, whatever have you. These organs operate autonomically, meaning a fancy word of saying automatically, right? Whether we're awake or asleep, our liver does what our liver does, right? We don't really have any conscious control over it. And that goes for all our organs except our lungs. Our lungs hold that unique position where if you're unconscious, they do what they do, just like every other organ. But if you're conscious, you can hold your breath, you can change the way you breathe, you can consciously control your lungs at the same time. And you can actually, while you're conscious, flip between your lungs operating automatically to consciously. So they're very unique in that there's that connection. Now the theory goes, and remains to be absolutely proven, but functionally it seems to be true that if you can change or manipulate your breath consciously, then you can affect change in your autonomic system. And that's the theory behind using breathing to soothe your nervous system and calm down. Okay. Yeah, I won't go deeper into that. I don't want this to be long. And the other piece of background I want to get into is just a little brief explanation of some anatomy, which is your nervous system. So one, let's say, department of your nervous system is your autonomic nervous system. That's the part of your nervous system that supplies the areas of your body that are not consciously controlled, we'll say. Okay, we'll just keep it simple. And that's divided into two halves. There's the sympathetic nervous system and the parasympathetic nervous system. Okay, fancy words, but the sympathetic nervous system, I think you remember this from high school, is your fight or flight response. And your parasympathetic nervous system is your rest and digest response. So you can think of them as opposites. Functionally, they kind of operate as opposites. So when you are feeling very stressed and anxious, it's almost always the case that your sympathetic response is kind of jacked up, right? It's overactive, it's hyperactive. And your parasympathetic is kind of de-escalated. So what you would like to see with someone that's feeling very anxious is for them to soothe that sympathetic response and bring the parasympathetic response up higher, or even some kind of balance here. So that soothing of your fight or flight response, your sympathetic response, is key. So how do we accomplish this? Okay, so that's the background. Let's get into the actual technique. I'll try and keep this as short as possible. I want you to know, though, this is very, very introductory and preliminary. This is not some advanced technique. So when I'm dealing with my patients, this is usually step one or even half of step one, okay? But I just want to keep this short. So what we're going to do is we're going to do some deep relaxed breaths, breathing in through your nose and out through your mouth or your nose. It doesn't matter when you're exhaling because that's just a waste of air. But always breathe in through your nose because you have a filter. Okay, for now, what I want to do is I want to keep the amount of time you're breathing in and the amount of time you're breathing out as equal. Okay, now I'm going to suggest to start at the 3-second mark. That means you breathe in for 3 seconds and you breathe out for 3 seconds and you follow that pattern. That's just an example of a starting point. The time, the 3 seconds, is not important at all. What's important is that you feel comfortable, you feel calm, and you feel like you can sustain that type of breathing. And what I mean by that is if you're breathing in a way that's unsustainable, in a very short time you'll start feeling like, oh, I'm not getting enough air, or it's not comfortable. If you have that sensation, you need to adjust the timing until you feel that. Okay, now I think 3 seconds in, seconds out is a very good place for most people to start. If you're feeling very anxious, you might actually want to start at 2 seconds in and 2 seconds out. But as soon as you can, you want to start extending that out, and that's the key. As you feel comfortable with whatever timing you settled on, you want to start expanding that out. Now, does it have to be exactly 3 seconds or 4 seconds? No. Go with how you feel, but you want to keep them more or less equal. What I mean is by the inhale and the exhale. So I don't want this to be too long, but I'll just give you a quick example. So let's say we're breathing. So let's start with the inhale and we'll follow with the exhale. So inhale for 3 seconds. 1, 2, 3. And now exhale for 3 seconds. 1, 2, 3. In. 1, 2, 3. Out. 2, 3. So in. Out. In, out. Okay, I'm not going to do too much of that because it's going to get really boring really fast, but that's the idea. So I started there with 3 seconds. If that feels like it's like too fast, perfect. You're going in the right direction. Start extending from 4 to 4 seconds, 4 seconds in, 4 seconds out. So the idea is to keep elongating it. Let me rephrase that. The idea is to eventually have the goal of elongating the breath so it gets longer, right? So if you have to start at 3, that's fine. But once you get used to that, start going to 4 seconds. Now, the better you can do this, the more calm the sensation will be, and the longer you can extend it out. Let's say you could get to 4 or 5 seconds in and out, the deeper the calm you'll get. But remember, if you go all the way to 4 or 5 seconds in and out, you have to be comfortable, and that has to be sustainable. If you're straining yourself to get those long breaths, that's not going to be calming at all. So it takes work. So here's the thing. This technique, it's not a pill, it's a skill. What I mean by that is it's not like you have a headache, you take a Tylenol, the headache goes away. It's not like that. You may find when you first start that it's a little bit difficult to do this and feel calm and feel like it's sustainable. That's something you have to practice and get better at. So when you first start, you might not feel any benefit from it. But in short order, if you stay with it within a week or two, you should find that as you're doing it, and maybe for a few minutes afterwards, you feel a little bit more calm. And that's great, but that's not the goal. The next step after that is to actually practice, increase your skill enough that that calm sensation bleeds in to other parts of your day, eventually the whole day. But that takes time. Minimum 3 months of consistent practice. So how long should you practice for? Well, there's no should. I don't want to give you a specific prescription, but how about I give you a starting point? What I usually tell my patients is start with 1 minute and 15 seconds per day, 7 days a week. I usually say use your cell phone, set the timer. Remember, the timer is what counts down to 0. Make sure it makes some kind of sound when it gets to 0. So this way you outsource the keeping of time, so you're not on your head thinking about how much time went by. And you just do your 1 minute and 15 seconds, do your best. You're going to find that you're going to make mistakes. You might feel like you're out of breath. You might feel like you're thinking about things you shouldn't be thinking about. You might, whatever it is, distracted. As long as you come back to the practice as best you can, don't judge yourself, don't get frustrated, just practice for your 1 minute and 15 seconds every day. You'll see within a week or two that you'll start getting a little bit better at it. It's a little bit easier, a little bit more focused, and you'll feel a little bit more calm. In terms of the timing, like I said, start with the 3 and 3. If that's too much, start with 2 and 2. Don't go shorter than that. But even if you start with 2 and 2, as soon as you feel comfortable to do so, extend to the 3 and 3. This is really important. And same thing, when you get comfortable with the 3 and 3, start extending to the 4 and 4. Okay? With the ultimate goal, I would say between 4 and 5 is great. If you can get to 4, I think you're doing really good. Okay, I don't want to make this too long, so I think that's pretty much all I want to say. Thank you very much for watching. We'll see you next time.